Good afternoon, everybody. This is Amanda Pierce-Kelly, the National Advocacy Director at NAC. We are really excited to be able to speak with all of you today about all of the latest developments that are coming out of Washington, D.C. on the Hill. All of the challenges, the opportunities, our health center priorities in terms of policy, of course the messaging and the ask, and then all of the advocacy work that we're going to need to be focused on starting today and for the next several weeks and months as we head into the summer. So before we go ahead and get started, I'm going to go through some housekeeping. The audio today, hopefully you guys can hear me, but if not, hopefully this slide is a helpful guide. Most of the audio today is going to be provided right from your computer, so we'll leave this up for a second for folks to be able to adjust accordingly to be able to hear us today. We do that to ensure a maximum ability for participation. There are a limited number of phone lines, but the best thing that you can do in order to make sure you're hearing everything is to plug in via your computer. So that's the direction on that. The other thing to note is that the webinar, as always, is being recorded today. Once we finish up, we will go ahead and make the recording and the slides available on hcadvocacy.org/past events. Typically, it takes about 24 to 48 hours to get those things posted. We also will push this out via our NAC Washington update, which comes out once a week. So again, if you can't stay for the entire conversation today and or you want to share this presentation with your colleagues back home or elsewhere, please make sure to check either the Health Center Advocacy Network website or look for it in the NAC Washington update coming soon. Final piece here, if you have questions at any time throughout the conversation and the presentation today, you can go ahead and enter those questions into the chat box. That's the best way to get our attention, and we'll do our best to take your questions at the close of the presentation. If for some reason we can't get to you, if there's not enough time, we will follow up with folks individually to make sure that your questions are answered. But again, if you have a question at any time throughout the discussion today, you can go ahead and enter that into the chat box, and we will be taking those up as many as we can as we work towards the end of the presentation. So with that, I am going to turn it over to my colleague, John Sawyer, who's our Director of Federal Affairs, to walk us through what we're going to cover today and then dive right into the presentation. So, John?
All right. Thank you so much, Amanda, and thanks to everybody who's on the phone. I think we have a lot to cover today. What we won't be covering at all are leaked memos, anything about the intelligence community, or anything having to do with Russia. So even though those may be the things that have the biggest impact on the healthcare system and the healthcare debate going forward. But we have our plates full here in Washington just with the healthcare debate, and so we are going to start by kind of walking through updates since our last webinar. I think the biggest update, obviously, is that the House has now passed a version of health reform legislation, so we'll be talking about that. We'll be talking about what to expect as the AHCA, or the American Health Care Act, begins being deliberated in the Senate. And then we'll talk through some of the advocacy strategies, what the timeline is for the rest of the year, and some of the specific action items and steps that you can take to really influence the debate here in Washington. So with that, I want to start, as always, and most importantly, by refreshing folks on where we stand vis-a-vis health center funding. Obviously, I think folks know that the health center funding issues are proceeding almost on a parallel track to the health reform issues that are happening. But as you'll see from our timeline later in the presentation, you could well see these things come together later in the year. So first of all, we have now finished the appropriations process for fiscal year 17. The bill, omnibus bill, which means a large appropriations bill, passed on May 4th. Health centers received level funding at $1.5 billion in the discretionary pot of money. That's our annual appropriations. As folks know from the chart on the right, health centers get two different pots of money. So this is the light blue in the chart on the right. Indeed, they also, in the Senate bill and in the final bill, carved out specific amounts of funding to go to mental health and to go to opioid treatment. even though there's level funding, they were able to access this funding because there was certain expenditures last year, like on capital, that were one-time. So we're going to be keeping a close eye, and we'll let you know when HRSA begins taking action on those mental health and opioid-related expansions. Because we are so far already into the fiscal year 17 process, that was supposed to have finished up in October of last year, but they've kicked the can pretty far down the road. That we are also already well into the process for fiscal year 18. So all of you as advocates really worked very hard to get members across the political spectrum to sign on to our House and Senate appropriations letters related to health centers. We had really, really strong numbers this year, very bipartisan letters. As you can see, 290 co-signers in the House, 62 co-signers in the Senate. We have also seen and mentioned in previous podcasts, maybe we should have a podcast, webinars, that the Trump administration has released a very, very, what they call skinny version of their budget for fiscal year 18. That was back in March. The entire Department of Health and Human Services budget was summed up in 2 pages in that document, although there were several positive references to health centers. We are expecting next week to see the full budget, so that would actually have the line-by-line program requests, and it's important to remember that the President's budget is a request and proposal, not the final budget. That will be determined by Congress. So we are requesting on that side of the fence, again, at least level funding, but also need to point out to folks that that cliff fix on the mandatory side on the right needs to be done before September 30th. So as a reminder, the extension of funding that's there in the orange that we had under MACRA 2 years ago, the first cliff fix does expire September 30th. Same is true for all funding for the National Health Service Corps and the Teaching Health Centers Graduate Medical Education Program, as well as several other programs listed here. All told, there's almost a dozen and a half programs that have expiration dates this fall. And because of that, Congress is working on what they call an extenders package, taking many of these programs that are set to expire and extending them. We are pushing for at least 5 years, but I think the later the process goes, the more they draw this out, the closer we get to the deadline, the real risk is that we will have a potential collision with the AHCA and the healthcare debate, which is proceeding along the same timeline, but also that we end up with a much shorter term request. So we're really, at the same time as we're very engaged in the health reform debate, really trying to increase the noise and increase the volume on the urgency of getting the health center funding cliff and the primary care funding cliff addressed as early as possible. So let's switch gears for a second, and we will talk about the American Health Care Act. I'm going to turn it over to my colleague, Michaela Keller, to talk a little bit, go back through some of the basics of the House bill, walk through some of the last-minute changes that were made to the House bill that got it over the line, and then begin looking ahead towards the Senate. Michaela?
Great. Thanks so much, John. And as John mentioned, I just wanted to take a couple of minutes to walk through some of the changes that were introduced in late April to the American Health Care Act, which ultimately provided the necessary votes to pass the bill in the House in early May. But before we get into those changes, we want to provide a couple of quick updates and a refresher on some of the basic provisions of the original American Health Care Act that was introduced back in March, and these provisions also remained upon House passage of the bill in early May. And these include the elimination of the Affordable Care Act's individual mandate, along with a shift in the Affordable Care Act subsidies from an income-based credit to an age-based credit. The bill also included major changes and cuts to the Medicaid program, including the rollback of the Affordable Care Act's Medicaid expansion, along with the change to a per capita cap structure within the Medicaid program. As you all may recall, back in March, the Congressional Budget Office estimated that the American Health Care Act would cause about 24 million people to lose coverage by 2026, and ultimately, as you all, I'm sure, are also familiar with, the original bill did not get a vote in the House soon after it was introduced back in March because there were not enough votes at that time to pass it. And this was due to a couple of factors. One of the main factors including that members of the Freedom Caucus, or the House Republicans that are generally more conservative, did not think that the original AHCA bill went far enough in terms of repealing some of the Affordable Care Act requirements around the insurance market. While on the other side, some of the more moderate Republicans in the House thought the bill actually went too far in rolling back some of the Affordable Care Act provisions. So for very different reasons, several Republican members back in March were unable to support the first iteration of the American Health Care Act. That being said, the push to pass the bill continued over the next several weeks, culminating at the end of April, when changes were finally agreed upon and provided an opportunity for additional Republican members to show their support for the bill. And the first of these last-minute changes is known as the Meadows-MacArthur Amendment. This amendment was negotiated by Representative Tom MacArthur, a moderate Republican from New Jersey, alongside Representative Mark Meadows from North Carolina, a conservative Republican and also head of the Freedom Caucus in the House. And essentially, this amendment allows for a couple of things. First, it allows states the ability to apply for waivers from the Affordable Care Act's or essential health benefits requirement for marketplace plans. So with a waiver, states are basically allowing insurers to provide a more limited package of health benefits in the marketplace plans. In addition, this amendment allows states the option of waiving what is known as the community rating requirement, which was first established in the Affordable Care Act. And by waiving this, states would allow insurers to charge higher premiums based on the health status of a person. So essentially, this gives states the option of charging higher premiums for persons or for people with pre-existing conditions or serious illnesses, something that I know we heard a lot about through the media and other sources, in the weeks leading up to the House passage of the bill. So in order to qualify for this waiver, states would also need to show that they have a mechanism, what many considered a high-risk pool, to provide or subsidize coverage for these individuals with pre-existing conditions or serious illnesses. So while these waivers did not deny coverage to individuals, they most likely allow insurers to charge individuals an amount that they would not be able to pay, leaving many uninsured. So despite a good amount of pushback on the fact that these high-risk pools would not suffice in subsidizing coverage for individuals with serious illnesses or pre-existing conditions, these waivers were, in fact, enough to satisfy the more conservative members of the Freedom Caucus who wanted to see fewer insurance market requirements. So the second last-minute change to the bill came just 2 days before the House ultimately voted on the American Health Care Act, and this was known as the Upton Amendment after Michigan Congressman Fred Upton, former chairman of the House Energy and Commerce Committee. And this amendment provided an additional $8 billion towards these high-risk pools to cover those priced out of the marketplace as a result of the provisions that were included in the MacArthur-Meadows amendment that we just discussed. And this amendment was necessary to win over the support not only of Congressman Upton, but of some of the other moderate Republican members who felt that the MacArthur-Meadows amendment went a little bit too far in terms of waiving protections for individuals with pre-existing conditions. So ultimately, with these last two changes and amendments, the House Republicans were able to reach the necessary votes for passage with a vote of 217 to 213. And while the changes that the amendments provided for are certainly concerning to us here at NAC, they primarily impact provisions related to the marketplace plans. And for health center purposes, the Medicaid provisions included in the original bill are still included in the full package that was passed in early May. So now that the bill is in the hands of the Senate, there are still a number of hurdles that must be overcome, including the fact that the provisions included in the Meadows-MacArthur Amendment may not even pass the threshold in the Senate due to the restrictions around reconciliation, along with the fact that Senate Republicans can only afford to lose 2 votes, which is a very slim margin. So to talk a little bit about what's happening in the Senate, I'll turn it back over to John.
Great. Thank you so much, Michaela, and thank you for that really, really good summary. I think, the big takeaway there is all of our concerns with the House bill that were in the original bill, we still have concerns. Those provisions were not made better. They were not made more generous at all. And in fact, I think from a lot of folks' point of view, the changes at the end in those two amendments that Michaela really detailed made the bill even worse. And so while I think, especially with Jimmy Kimmel and a lot of the other coverage of the bill as it passed focused on pre-existing conditions, we're really doing our best to make sure that especially the Medicaid cuts concerned in this bill don't get pushed to the sidelines in terms of how much public coverage they're getting. So this is a chart kind of showing the difficulty and the complicatedness of the dynamic in the Senate. The Senate, as Michaela mentioned, the vote margin in the Senate is very, very tight. Republicans have 52 votes in the Senate. Democrats have 48, and so therefore they can only lose 2 votes and still pass a bill under the budget reconciliation process. That process, which we've talked about in past webinars as well, really limits sort of what's in and what's out and what can be considered under a bill like this going through the Senate. A lot of the provisions, as Michaela said, that were in the House bill will probably not pass muster according to the reconciliation rules when things go through the Senate. But nonetheless, they are really taking a lot of time and putting a lot of energy in the Senate now towards drafting their own proposal, even though they've said a lot publicly that they are starting from scratch and leaving the House bill out. The inside scoop is that they are generally working off the structure of the House bill in the Senate, and there are a number of important groups. This is what we tried to capture here in this chart. All of these are Republican senators who are involved in the overall debate in the Senate about the health care bill. These aren't the only ones, but this is just a demonstration of how complicated this can get very quickly. What you see in the sort of light red, pink circles there are senators who are coming from Medicaid expansion states. And many of those senators, though not all of them, have been very outspoken about the need to either preserve the Medicaid expansion or have a much slower transition out of the Medicaid expansion than the House bill would do. What you see in the big blue circle in the middle is what's been called the Senate Healthcare Working Group. This was appointed by Leader McConnell, the Republican leader, and includes 13 members. I've actually neglected to put Senator Enzi on here, the one more member, chairman of the Budget Committee. Interestingly and very, very publicly noted, all male members of the Senate Republican Conference, and has been really tasked with working out a lot of the difficulties. You see a range of political ideologies here, from more moderate members like Dean Heller and Rob Portman, all the way towards Mike Lee and Ted Cruz further on the right. So that working group is meeting regularly. In the purple, there has been an alternate working group formed. Maybe the kids who were not invited to the first party had their own party. There are also now bipartisan groups being formed. So there's a lot of different dynamics in the Senate. And then in the green there, you see that Republican leadership who's really driving the process forward. So, you know, there are a lot of complicated sort of interactions here. The Senate tends to be a slower place in general. Obviously, the other political concerns that we kind of joked about at the beginning have the strong potential to slow things down, which I think from our perspective is not necessarily a bad thing. But I think it's notable that, you know, with these working groups and all of these, you know, sort of different groups meeting regularly, what they're not doing is having an open committee process in either the Finance Committee or the Senate Health, Education, Labor, and Pensions Committee, which would normally have jurisdiction over a bill like this. These meetings are being held generally in secret. They're not being shared. They're not being publicly aired. There have been opportunities for groups, including NAC, to weigh in, and we'll talk a little bit more about how folks can weigh in. But, you know, even if they take the next couple of months, which really is the goal, to have action before the August recess, we're still talking about a very, very fast process on a very complicated piece of legislation with huge implications and not really, the normal committee process where all of that would really be debated and amended in a public way. So that is kind of like the overall dynamic in the Senate. Happy to get into questions when we get to the questions on that. But now we're going to talk for a second about what every single health center in the country can do to influence the Senate debate. So we are working here at NAC hand in glove with the primary care associations in every state to work with them, to work with all of you, to organize statewide letters to senators and governors related to the American Health Care Act and the debate that's underway. Our goal is to complete these letters next week and get them up to the Hill. That's obviously ambitious and that takes some organizing, but it's really important to be present and on the record in this debate early so that we can have the biggest impact. The template letters, which have, as we said, gone to all the PCA CEOs and state legislative coordinators, so if you haven't heard from them yet on this, you definitely will. They focus sort of on three things. It's an introduction that really emphasizes the role of health centers within the healthcare delivery system in each state. Then it walks through in some detail our overall concerns with the House-passed version of the American Health Care Act, primarily the changes to Medicaid, the changes to the subsidies and tax credits for private insurance, the weakening of consumer protections, et cetera. And then it goes into principles and recommendations to the senators moving forward. And so, you'll see in this letter that the first recommendation is a familiar one to anyone in the medical community, which is first, do no harm. That any legislation that passes the Senate should not eliminate coverage for any American going forward. And we also talk a little bit more specifically in that piece of the letter about some of the health center-specific concerns, both around maintaining the PPS payment within a larger and stronger Medicaid program and addressing the health center's funding cliff. And just, we don't want to send anything up to the Hill at any point that doesn't make the point that we have a giant funding cliff coming this September. So keep an eye out for these letters. Feel free to reach out to us, and we will put you in touch with the PCA, making sure that everybody's got these. But the goal is that the letter go to the senator as well as to the governor, who is going to have a critical role in informing the Senate debate, and that it be signed by every health center in the state. We will also have, and I know that the advocacy team is going to jump into this here, several other ways for folks to weigh in, I think starting today, and some other tools to engage elected officials at other levels of government. So with that, I will turn it over to Elizabeth, who's going to give us our first advocacy tip.
Thanks, John. Hi, everyone. And not to belabor this advocacy tip too much because of the information that John just went through, but the first one here is to work with your state primary care association on those letters that he just mentioned. And it's the advocacy tip because we really do have a tight timeline on that. John mentioned we want to get these done by next week. So please be in touch with your PCA if they have not already been in touch with you. And if you're not sure who that is, then you can go ahead and contact us and we'll put you in touch as well. Thank you. And just one more quick advocacy tip before we jump back into the policy slides is to not only make sure that your senators and your governor are educated on our issues and up to speed, but to really reach out to your state and local officials. And that includes your state legislators and your governor as well as your mayor. That's another great touch point. One of the things that we'll be talking about later with the launch of the new advocacy action items is storytelling. So the advocacy tip here is to collect stories to make the case about the value of your health center. This really isn't anything new, but an ongoing activity that really does have an impact. We have templates available on that website right there, hcadvocacy.org/makethecase. And I know Amanda's going to talk a little bit about this more in depth later, but that is your second advocacy tip for today.
Okay, thanks, Elizabeth. We're just going to, before we go on to each of the rest of the advocacy steps, we thought it would be important to just kind of lay out what we know now about the timeline for the rest of the year between now and September 30th. As you can see, I think working backwards from there, September 30th is when many things all come to a head, and hopefully we'll be able to address these things well in advance of that late date. But you know, the Community Health Center Fund, our mandatory funding, as already mentioned, the Teaching Health Centers Program, National Health Service Corps, the Children's Health Insurance Program, government funding for the fiscal year, as well as any number of other programs that we're calling those extenders, all do finish up at the end of September. So between now and then, we're really going to see action beginning as early as next week. When we mentioned, as we mentioned, the President's budget will be released next week. Also next week, we're expecting the final Congressional Budget Office score on the American Health Care Act. So then we'll see the appropriations process begin for the year. We are talking about and putting the final details on a targeted fly-in of PCAs and key contacts to come back to town to really make the case to the Senate now about health center key priorities. The Senate is now beginning their consideration of the American Health Care Act. And then you can see in July and August, we don't know as much detail about exactly where things will be. We know Congress will be in recess, both for the July 4th recess as well as for the entire month of August. And as we'll talk about, I think, in more depth in next month's webinar, it's really critical that health centers get their members of Congress out to the health center, get meetings, go to town halls, and really participate and get in front of those elected officials during that time. But I think what this, you know, and as we said, the Senate is aiming for passage of the health bill before the August recess. I think what all of this underscores is that we do have a tight time frame to get a lot of things done, but we have a real opportunity now to really ramp up our advocacy over the next couple of months, both here in D.C. and working with members directly in their offices, but also out in the field and really taking this time to stress the vitality of the issues that are going on right now for our health centers and for our patients. And so I think with that, we're going to turn it back over and get into a little bit more detail on that advocacy plan going forward. Elizabeth?
Great, thanks. So your last advocacy tip for today is to complete the action alert that we now have up on the website, and that is a Senate-specific alert that asks Congress to support a strong Medicaid program and continued funding for health centers, and that is currently up on hdadvocacy.org/takeaction, and you can email, tweet, send a Facebook message or post, and call your members directly through the Grassroots Action Center.
Great, thanks, Elizabeth. Hey, everybody, it's Amanda Pierce-Kelly again. We're going to spend some time now going through the advocacy update and going into a little bit more depth around the kinds of actions and the menu of action items we'll be asking the Health Center Advocacy Network and each of you to be active on. Now that you've had a lay of the land in terms of what's happening in Washington and, frankly, all of the things that are happening back home in your state capitals and locally and in your counties. Advocacy has never been more important, and so today what we are doing is launching a brand new menu of action items. They're sort of broken into 3 different buckets. The first is an effort to engage all elected officials with some emphasis on different constituencies within that. The second bucket is participation in National Health Center Week, and the third is an effort to build and continue building advocacy capacity. The reason that we've broken it out this way is that we actually have taken into account and listened heavily to the response and the feedback that we've received from the Health Center Advocacy Network about the best way to enable advocates to get involved. What do they want to see and how do they want to do that, and what are the easy ways to make this accessible in terms of advocacy? And some of the feedback that we received is that providing a menu of options really allows advocates to choose how they want to engage and recognize that it's not a one-size-fits-all when it comes to advocacy. And so while we absolutely encourage and we hope more than anything that each of you and all of the health center advocates out there will take all of these steps, if everyone just chose one thing from this new menu that they would take on, that they would take action on, we would be really in an incredible position, far better off than where we are right now. And so just encourage you guys to think as we're going through this, what is the action that you are prepared to take? Are there several? And what can you share? What can you do to engage the rest of your network back home at the health center and across the community to make sure that the health center voice is not just represented, but comes across loud and clear to all of our policymakers and the influencers out there. So with that, the first, engage your elected officials, that first bucket. You've already heard us talk about the importance of engaging your senators and your governor. John and Elizabeth both talked about that statewide sign-on letter. If you've not yet heard from your primary care association, look for that communication coming very soon. We did establish a deadline for signing on to that at the health center level coming up next week, and that's really, again, to stay in step with the timeline that Senate leadership has signaled in terms of the work that they are doing in consideration to the AHCA. The other piece here on the federal side is, again, to make sure that you take action on that Senate AHCA action alert. Elizabeth just went through that. There are a number of different ways you can do it. It's very simple and very easy. We provide you with a pre-populated message, email message that can be sent right up to your senators. We do encourage, that being said, that as you're sending those messages, you really do your best to make it representative of what the impact would be back home. So if you have an opportunity, go ahead and look at what that localized information and impact might look like for your health center in your community and drop that into the message. If you don't have time, then go ahead and send it just as it is. We've designed it in such a way that the message is sound and strong and clear and will certainly resonate as they arrive at those Senate offices, but always helpful when you take the time and the extra attention to tailor it to your specific situation in your community. The last piece under this particular element is that we have template letters to the editor and opinion editorials that are really designed to deliver the health center message at the community level and do a great job of describing what John went through in terms of our concerns with the currently proposed version, House version of the AHCA, and our priorities for what needs to be intact going forward to make sure that the health center program is well supported and protected, but also that our patients and the needs of our patients are thought through and supported as this piece of legislation is worked through at the congressional level. So again, we've done our best to make sure that we've created language and templates for you to be able to place these and submit them to your local media outlets to make sure that we're delivering the health center message across the community. So take advantage of those. Everything is located under the Make the Case section of hcadvocacy.org. So the other piece under engaging elected officials is really geared at making sure we are raising awareness and doing the education and sounding off at the state and the local and the county level. And so very much in line with the statewide letters that will be sent to senators and the governor, we've also created a template letter that you at the health center level as individual advocates and as an organization can send to your mayor, your state legislators, and your county officials. It's incredibly important that they hear the same consistent message across those elected officials at the local, the state, and the county level. The reason is that all elected officials communicate with each other, and so it is not uncommon for your U.S. senators to be checking the temperature and looking for perspective and insight from the mayors back home at the state level, from state legislators that are concerned and able to communicate the true needs of folks back home on the ground locally. And so touching these folks, the mayors, the state legislators, and your county elected officials to make sure that they understand exactly those same priorities and concerns has never been more important. And so really, we encourage you guys to take advantage of that template, shoot those off to your elected officials at those levels. It is a wonderful counterpart and reinforcer to the work that we're doing with our senators and our governors. The other piece is to make sure you're coordinating with your primary care associations to set up in-person meetings with your governor. Many of you have already been successful in connecting with your governors to talk about a host of priorities and concerns at the health center level. Well, it's time to continue that conversation. As this legislation is moving through Congress, frankly, we really need to move the dial in terms of making sure the governors understand the true implications of what this would mean at the state level. And so there's no better way to do that than by coordinating with your primary care association to set up those meetings. For those of you that may have a personal connection to your governor or high-ranking state officials, first of all, we want to know about it. If you've got good access there, please don't be shy. Please let us know. We'd love to work with you to make sure that you have the resources and the support necessary to have this conversation. But certainly that's very important and meaningful information to share with your primary care association as well for the same reasons. So again, just make sure you're in step and that we're all working together to stay in good coordination. The last piece under engaging elected officials has more to do with the human impact, and you all have probably heard us speak to this quite a bit. We're really encouraging advocates to collect and share patient stories. There's a number of different ways that this can be done. We've created some templates and resources to help you all in this direction, but the importance of this is that while we talk often about the dollars and cents and the data and the policy piece of what is going to change and what the impacts might look like from an operational perspective, it is so critically important to speak to the human impact of what these changes and proposals could mean. And so collecting and sharing patient stories about what these shifts and proposals look like to your individual patients, to your staff at the health center, that has to be a part of your advocacy. And so, again, as I said, we have template materials to help you tailor collection efforts at your health center. We have a one-page how-to on how to set up story collection at your health center. And we also have links to share your stories across social media. Of course, the goal in part with this is to make sure that these stories are in front of your elected officials. And again, not just your senators and your governors. I think your state, your county, and your mayors also need to hear these patient stories. A great way to do that, simple, straightforward, is across social media. And so again, you'll see under this section as part of this action step, 2 different links to Twitter and Facebook to empower our health center advocates to tell their story right there on social media. So the next bucket, which is participation in National Health Center Week, we have a few different action items under National Health Center Week. Just as folks will recall, National Health Center Week, and we're going to get into this later, so I won't go too deep dive, but National Health Center Week is our time. It's our week-long observance to showcase what health centers do well, to educate the community about the incredible work that you're doing in your community with your patients, and connect them with resources that they may not have been able to connect with previously. The other piece of National Health Center Week is to engage your elected officials, to get them out to see with their own eyes all of the great work that you are doing. And so what we're asking and encouraging for the action steps under National Health Center Week is that every health center, if they haven't begun already, plan a National Health Center Week event, and that they make sure to invite their elected officials to participate in those celebrations. If you're not planning a specific event, that's okay too. You can just simply invite your elected officials to come out and visit and tour your health center. If they've been out recently, it's a great excuse to get them out for a celebration. The point is there's a number of different ways that you can leverage National Health Center Week in order to do that education, to raise awareness, and to share what's at stake for the health center and the patients you're serving in the community in consideration to some of these major policy issues that are taking foot right now. The last piece under National Health Center Week as we get closer will again be to work with local media in your communities to submit letters to the editor and opinion editorials to make sure that the health center message is being delivered loud and clear across media and more traditional media. Look for templates coming as we near National Health Center Week that will tell a very similar message and deliver a very similar message to those we've already mentioned. But the trick is, with National Health Center Week falling in August, it gives us a little bit of time to see how the work going on in Congress and also at the state level continues to unfold, so that we can tailor the messaging and the templates to accommodate that and make sure that we're on spot in terms of health center priorities in real time. So the last piece, and you'll notice that building advocacy capacity is one that we've kept consistent from our last menu of action items. we are asking every single health center to make sure that they have a health center advocacy plan. The reason for that is that we know in this environment, while there are wonderful opportunities for health centers going forward, there are also incredible risks and challenges, and we will need very strong advocacy in order to be successful. And so when we talk about the need to build advocacy capacity, we are asking every single health center to take part in that. And the first and very most important thing that you can do is by building your health center advocacy plan so that you know where you're starting and you know where you're going. We have template advocacy plans to help you in that direction and give you a good sense of where you need to be focused and how to build your plan. We're also available as a team to make sure to work with you, both in terms of crafting that plan, but also to provide training to make sure that folks feel empowered, informed, and comfortable to engage in advocacy. The other piece under building advocacy capacity at your health center has to do with recruiting new advocates. So part of the capacity building is making sure that we have a very loud and very powerful voice on behalf of health centers and the patients we serve. We are very excited to be able to say that we are 130,000 advocates strong when you take into account our full network. But I tell you what, we are more than 200,000 strong when you look at health center staff and board, and we are 25 million and growing patients nationally. We're the largest primary health care network of providers in the country. And while I'm so proud of our 130,000 advocate network, we've got a lot of work to do in order to continue to grow and make sure that there is good representation and voice behind those 25 million patients and those 200,000 staff and board members that are so actively involved every day with the workings and operations of health centers. So again, we're asking every health center to recruit new advocates. It's very helpful in this space to set a goal, whether it's 50, 100, or 1,000 new advocates. We do have templates to support you in this effort. I would harken back to National Health Center Week and just say that Health Center Week is also a really great excuse to help build your advocate network at your health center. So go ahead and give that some thought and take advantage, set a goal in terms of recruiting new advocates, and we're happy to work with you on that front as well. So many of you ask as a part of these webinars, but frankly in many of the trainings that we do, what can I do as an individual advocate? You know, I can certainly bring this back to my colleagues and I can take it back to my health center at large, but what can I do personally? And so here's a really quick list of things that you as an individual advocate can do. One is signing up as an advocate if you're not already. The second is helping with that recruiting effort. There's probably 10 people that don't know much about health centers, that aren't sure why it's important to engage, or maybe don't know what makes health centers different in terms of our model and the fact that we do have a 51% consumer majority board. That's an important story to tell and part of the tools that you can use to recruit new people to support health centers just the way that I know so many of you are doing currently. And the other piece is sharing your story. Each and every one of us have some connection to health centers. That's why we are advocates. That's why we choose to work in health centers. That's why we choose to be board members, partners, and supporters. Sharing your story about what's brought you to health centers and why you've chosen to stay involved and lend your support is an important part of the advocacy work that we must do. And that's a really easy way for you as an individual to help us deliver the health center message far and wide to make sure that our policymakers and our influencers understand the value of health centers every day. So the last piece is just walking through some resources for advocates. We have really tried hard to make sure that we have as many resources and templates, materials to support you in your advocacy work. We do have our brand new website, hcadvocacy.org. It is mobile friendly, and you can find all of the resources right from your phone or your tablet, just the way you can on your computer. But would just encourage folks to take a look. There's some really wonderful resources posted to the website, and of course, that's where you'll find this latest menu of action items under Make the Case. The other piece is that we've made sure to provide you with fact sheets and talking points, studies, anything that is going to help you in understanding the policy element of this. So make sure that you're taking a look at those pieces as well. And it's always helpful to be able to go back and take a look at these slides and listen to the recordings to get clarification if necessary. So with that, I'm going to turn it over to my colleague Alex Harris, who has recently been promoted to our Deputy Director for Advocacy. Very proud to announce that. Alex is going to walk us through National Health Center Week, and then I think we're going to move on to questions. Alex?
Great, thank you. Yeah, so Health Center Week this year is coming up quicker than we might like it to, because we've got a lot of work to do, and I know you guys are planning your events, but obviously this is one of the best ways to really highlight the amazing work you guys do at the health centers, the work that's going on in your states if you work at a primary care association, and just really be able to build the public awareness and support for what's the impact that you really have in your community. So this year's dates are August 13th through 19th. So if you haven't started planning for Health Center Week and you missed out maybe on the last week's Health Center Week kickoff webinar, I definitely encourage you guys to take a look at some of the resources we have at www.healthcenterweek.org. It's a brand new website, so it's very sleek and modern and hopefully easy to find all the things that you need. And you can go ahead and download a bunch of tools, images, resources, etc., to start getting you prepared for this week. We also have the list of focus days on the website and this year's theme, which is the key to healthier communities, celebrating America's health centers. You'll see some accompanying resources for that as well. So definitely take a look. We've got some resources that are coming soon, but already a ton of event ideas. And it's never too early to post your events to the website. We try to keep track of all the events that are happening nationally because we want to be able to spread the word publicly and connect you to potential resources. So please definitely, if you have something planned or in the works already, go ahead and go to the website and click post your event because we'd like to see what's going on. And then we have a few things coming up pretty soon here. First of all, if you missed, like I said, last week's National Health Center Week kickoff webinar, you can view the recording on the HE Advocacy website, so headvocacy.org/past events. That's where you'll actually see all slides and recordings of previous webinars that we've done here at NAC Advocacy, including these policy and advocacy update webinars. So I encourage you to bookmark that link and take a look at some of the stuff that's happened, and definitely check out the Health Center Week kickoff webinar. We have our next policy and advocacy update webinar coming up pretty soon in June, on Wednesday, June 21st at 3:30 Eastern. And so we definitely encourage you to go ahead and RSVP there. You should get all the webinar login information and accompanying resources, so never too early to go ahead and RSVP for that and mark that on your calendar. And then a little bit later on in July, Wednesday, July 19th at 3 p.m. Eastern, we're going to have a contest, a webinar regarding our contest for Health Center Week to really make sure you guys are in the loop of what our picture and video contest encompasses, what the rules are, and how you can win support for your Health Center Week events and for your health center going forward by showcasing the amazing work that you're doing. So definitely go check that out and go ahead and RSVP. And with that, I think we'll go ahead and take questions. So I see some of you guys have posted things in the chat box. It's not too late if you want to go ahead and ask your questions there. And then I've seen a few, like I said, that I can plug in here for the team. So the first is, and I know this was discussed a little bit, but can we talk a little bit about how the timeline for potential vote on the AHCA looks like? This person says, we've heard McConnell won't bring it to the floor until he has the votes, but do you have any idea as far as that timeline? And then also how that works in with the potential, the CBO score on the final version of the House bill.
So that's a great question. It's the $880 billion question here in Washington, D.C. But we do know a few things. So like we said, I think the CBO score, the Congressional Budget Office score, which is sort of the independent body in Congress that says how much does a bill cost and what would its impact be, in this case, particularly on coverage. We are expecting that as early as next week, and that would be the CBO score for the final bill that came out of the House. I think as folks remember, they did issue a score early on in the House process on the original bill, but obviously they have to take into account some of those late changes that Michaela described that were being made in the House bill right up until the last minute. So that really marks the official beginning of Senate consideration because they really need to know what they're working with. Again, even though they say that they are starting from scratch and building their own bill, they are limited in some ways by the rules that say that they can't spend more than the House bill spends, or they can't save less than the House bill spends. So, really importantly, CBO Score kind of sets the beginning there. I think conventional wisdom is that it will take at least 4 or 5 weeks, if not all the way till the August recess, to produce a bill in the Senate. And then the Senate bill will also need to be scored by CBO. The question remains whether they will take a vote as the House did without a final CBO score. Most senators, even on the Republican majority side, have said that they will need to see a final CBO score before they vote on the bill. So right now, as folks noted, Leader McConnell has said he will not take the bill to the floor until it has the votes to pass. He is very good at this and knows exactly how all of his members are voting. But he has also said that he really wants it to go forward before the August recess. And so that is really the timeline that we're looking at for Senate passage. What that sets up, and we sort of alluded to this earlier, is that the Senate could send the bill then over to the House at the end of August. This is hanging out there over the August recess. I think we've already seen some of the town halls and other public input to the program, so that will be very interesting. And then they'll have to come back in September and either go to a conference committee where they work out the differences between the two bills, or what's potentially even more likely is the Senate sends the bill back to the House and simply says, take it or leave it. What's unclear at this point is what's going to happen if that happens. And then, obviously, in September, we are already very, very close to the Health Center funding cliff, the end of CHIP funding, some of those other must-do pieces. And so it will be very interesting, and we're paying very close attention to whether those pieces get wrapped up in this debate. We would like to keep that all very separate. CHIP, health centers, National Health Service Corps, all of those pieces, very bipartisan, non-controversial programs, but we're doing our best to really make the case that those need to go on a separate track and really need to be done before the American Health Care Act continues to move ahead. So that's a long-winded answer, but I think the bottom line is we are expecting, if the Senate can pass a bill, it will be shooting for before the August recess.
Great, thanks, John. And so can you also speak to the actions and the email and the letter that we're sending and we're asking advocates to send to the Senate? Does that position taken in that text change any from our previous position on the HCA?
It doesn't. I think it elaborates on it some. Folks will see that the letter to the Senate, the statewide letter to the Senate, is actually quite detailed. It is about 3.5 pages with, a number of bullets that really break out point by point both our concerns with the House bill, which NAC has expressed previously in multiple different statements and letters to the Hill, but then also our sort of principles moving forward around maintaining coverage, a strong Medicaid program, addressing the health center funding cliff and the workforce issues that are pending out there. So I think it is a lot of what we've been saying going back to, frankly, last year, the fly-in at the beginning of this year, the P&I, really distilled into one letter that really hopefully will make it very clear to senators where the health centers in their state stand.
Great. And then can you also speak to what the bill does relative to Planned Parenthood funding and health centers specifically?
Yeah, that's a good question. It's one that we've discussed on earlier webinars. I think folks are aware that going all the way back to the first House Republican and Senate Republican attempt to repeal and replace the ACA last year, the bill that passed last year but was vetoed by President Obama. And in the House version this year, there are provisions that would defund Planned Parenthood under Medicaid for 1 year and would make a corresponding increase in funding available to health centers through our mandatory funding stream in the current fiscal year. And so a couple of things to say about that. Obviously, this is a very difficult position to be put in. It's not something that NAC initiated in any way, and we've been in close touch with our partners at Planned Parenthood and around the country on this. When advocates are asked about this question, what we've suggested in the past is a couple of things. One is to really describe at the local level what your relationship looks like, the safety net in your community, how those partnerships are formed, what is being done locally, but then really to pivot to the funding issues that we health centers are facing ourselves. I think a lot of folks are not aware that health centers also are facing, if not a complete defunding, a significant cut to funding in the form of the funding cliff, and that we are really focused on that and, really couldn't possibly speak to our future capacity to take on additional patients when we have a 70% funding cut potentially hanging over our heads. And so, the only other thing that I'd mention relative to that is that this is yet another one of the questions that is very much driving the dynamic in the Senate. You have at least one and possibly up to 3 senators who are expressing major concerns about the Planned Parenthood provision, Senator Collins from Maine, Senator Murkowski from Alaska, and to some extent Senator Heller from Nevada. And as we reminded you folks in the Senate slide, they can only lose 2 votes. So if you lose 2 votes over the Planned Parenthood provision, you have to round up everybody else, from Rob Portman to Ted Cruz and everybody in between. So it is one of the driving dynamics, and we would not be surprised to see that provision potentially come out in the final Senate bill.
Great, thank you. So I've got a question here regarding advocacy, and is there any sort of sense of whether there will be future action steps with regard to the HCA, and if so, what can advocates anticipate coming out of HC advocacy?
Amanda, do you want to start on that one?
Yeah, I would just say the reason, well, there's 2 pieces of this, guys. The reason for the menu is that each of the items in that menu are actions that should be ongoing. Really, until something changes with the AHCA, each of the steps that we've outlined will be impactful and will specifically influence and deliver the health center message. Now, that being said, as this process continues to unfold, advocates should absolutely be prepared for specific calls to action in response to that. So as the Senate continues to work through its process, if it looks as though the bill is moving and it makes sense and is in the best interest of health centers, the patients we serve, and the program as a whole to weigh in aggressively, then yes, absolutely, we'll be sending a call to action out. It may be the call to action that's already posted, but with ramped up efforts and focus, or it could be an updated version of it. It's a little bit too early to tell, and I think, we all wish we had the crystal ball to be able to predict exactly what the timeline is going to look like and exactly what, the perfect strategy and tactic is going to be to impact the outcome. But the point is, we need to be nimble. We need to be prepared to act, sometimes with very short notice. And I think there's a certain element of trust here. NAC is always going to act and drive our advocacy in the very best interest of the health center program and our patients. And so when that call to action comes through, my request to advocates is to trust and believe that we are doing it and that it is important, and we are counting on you to be responsive in real time in order to have the largest and most effective impact possible. So that may not be as detailed an answer as folks would like, but it is the very best that I can do without knowing exactly the next step of our wonderful Senate and the rest of the Congress. John, I'm not sure if you have other things to add to that.
No, I think you covered it. I mean, this is, as we said at the beginning of the webinar, an environment where we don't know what's going to happen by the end of this webinar, much less, a week from now. I think that the goal of the statewide letters is to, really anticipate the direction that the debate will go, use this as an opportunity to get every health center on record and engaged with their senators as they begin deliberating, lay out some clear principles, and then obviously, as things progress, as we have bills to look at, provisions to respond to, we will be doing that, and we will absolutely be engaging the field because we're all going to need to be together on this going forward.
The other thing that I would add, guys, just so that you have a full transparency into all of the advocacy work that's going on, we're also deploying our health center key contacts to be doing targeted outreach with members of the Senate who we know are sitting at the table discussing these provisions and looking at how the continued evolution of the AHCA is going to take shape in the Senate. So we have ongoing outreach using our sort of what our wonderful Senior VP Dan Hawkins calls our Delta Force advocates to make sure that we are getting through to the most key members of the Senate and they understand each of the messages that we've been talking about here today in terms of the health center program and our patients. Other pieces that you all should know about is that we'll be doing rolling fly-ins, so those same folks and several others will be asked at the right time to come into Washington and actually sit in person with some of their senators and members of Congress who we know to have the most influence. So while these are the steps that we're taking in order to engage the broad network, please also understand that there is always and there will continue to be a very important additional layer to our advocacy where we're calling upon specific advocates with personal relationships with their members of Congress and their senators in order to make sure that the health center message is being delivered directly and personally at the perfect time, frankly. So when I talk about sort of the trust and believing that NAC is doing everything possible to make sure that we are absolutely as well positioned and represented as possible, it is very far-reaching and very strategic. And we're happy to always be talking with folks if you have more questions or ideas about other things that we can and should be doing. Of course, always open to feedback and suggestions.
Excellent. And so speaking of some advocacy action steps, we have a question here from an advocate who has a consumer advisory council that is interested in doing a petition drive, something like support health centers and keep Medicaid strong. Can you speak to whether petitions are persuasive or useful, or if there are other activities that might be a better fit for this type of action?
Absolutely. I would say that petitions are 100% an effective means for advocating. I think it is a numbers game when it comes to petitions, so the more names and signatures you're able to collect, the more compelling your petition is going to be with your elected officials. But yes, I think it is a wonderful tool and tells a wonderful story of the importance of that issue and impact to your health center and your community. I would suggest looking at pairing a petition with something like collection of patient stories and letters of support from others in the community that are concerned about the resources and the ongoing support necessary for health centers to continue to serve their community and fulfill their mission. Oftentimes when it comes to petitions, they do send a very important message, but it is good practice to pair them with a secondary piece to just strengthen your case. And so happy to work with you guys on that to map out sort of additional items that you may want to tie in, but really wonderful to hear that you're thinking about engaging your consumers, and that you have this advisory board and that they're poised to take action on this. We love to hear that and want to support and encourage that as much as possible.
Awesome. And so we have a question here too about CHIP, talking about the CHIP budget coming to a close on September 30th. And can you talk about what this would look like on the ground in terms of potential interruption of health care for those who are receiving CHIP insurance?
So that's a great question. Thank you, Alex, and thanks to who asked it. You know, same with the health centers funding. Funding for the Children's Health Insurance Program is set to expire September 30th. And if Congress did go all the way to that date, which we are advocating both on health centers and CHIP that they absolutely don't do, but if they did go all the way or past that date, we do expect pretty significant disruptions in coverage for kids, the same as we expect pretty significant disruptions in grant funding for health centers. So CHIP gets a little complicated in that the states are each on somewhat different timelines as to when their CHIP funding goes into effect and when their state budget goes into effect. So this is one where it's be good to follow up with your primary care association to find out what exactly the situation would be in your state. But I will also say, as with the health center funding, this is somewhat uncharted territory because we've actually never gone past these deadlines. And so, you know, there's a lot of talk here in D.C. about how states will need to begin sending out sort of cancellation notices, termination notices, even earlier than September 30th. And states need to know what their CHIP numbers will be in order to do their planning for their state budgets. So absolutely, I think these are serious pieces and really could have major disruptions in the system. So all the more reason that we're working really closely with not only our own advocates, but other groups around town, children's groups, children's hospitals, pediatricians, other advocacy groups, as well as folks working on any number of other programs, to really come together with one voice and say, look, we need to take action, we need to take urgent action to address these issues, and we need to do it on a long-term basis. But yeah, thank you for the question.
Awesome, and I think we have just one more question, although we still have some more time, so feel free to type your questions in the chat box. But somebody here is asking, is it still worthwhile to do any sort of advocacy outreach to members of Congress in the House, particularly if there's a relationship there?
I'll give a thought or two, and then Amanda, please jump in. I think absolutely. You know, I think whether your member voted against the bill, which is something we would want to show our thanks for, if your member voted for the bill, you know, I think you'd want to give them that same level of input and feedback about our concerns, about what the bill in the form coming out of the House would mean for health centers. But absolutely, I think it's important to stay engaged. Remember, this bill, well, first of all, there's a lot of things that are going to have to go through the House for us, even in the next short period of time. But one of those is this very bill. So even though they've passed it out of the House, we do expect changes in the Senate, which means it's going to have to go back to the House at some point. So people are going to get another bite at this apple. And I think it's important to really stay engaged. And I will make a special plug. I think if you have, and many of you have already done this, but if you have Republican members who really went out on a limb and voted against the bill because of some of the same concerns we have over Medicaid and pre-existing conditions and other pieces, it's important to recognize that. It's important to say that you have their back and you support their decision, at least in this case, to take a stand and vote against the legislation. And I know for a fact at least some of those 20 Republican members who voted against the bill did so with the direct input and at the direct urging of their health center constituents, and we really made a difference there, individual folks really weighing in. So I think absolutely it's important to stay engaged with the House.
Yeah, the only thing that I would add to that is that these are folks that we are going to need to work with for a long time, you know, certainly at least until the next election, and then we'll have a new crop of folks, many of whom will be returning. And so I think continuing to build and maintain your relationship is just an advocacy a best practice that I really strongly encourage. Where folks might have been disappointed by an action that they've taken or a vote that they've taken recently, I think it's important to express those concerns, but always to do it in a respectful way. I think for folks who have really historically supportive members, where you're not worried about, you know, their actions in the future necessarily, it's, of course, what John just mentioned, to express your appreciation and your gratitude for that continued support, but also to ask them what you can be doing. You know, they have their hands full, many of them, and are trying to sort through and navigate everything that's going on as well. And so it doesn't hurt to ask them how you can be supportive from back home, and ask if they have any recommendations about, you know, what types of advocacy are going to be most effective, and truly exist as a partner to them and a resource to them. So there are lots of different tacks that we can take, but I think expressing appreciation and doing every bit of our advocacy, always in a respectful way, is really key, and the House will continue to serve as an important part of the equation in terms of all of our congressional advocacy going forward. So yes, if folks have an opportunity to be in contact in the immediate, I would urge that, but I would also say National Health Center Week is a really wonderful excuse to invite them out to your health center to have some of these conversations in person, and again, to continue building that strong relationship where it can be you know, both folks can serve as a resource. Your member of Congress should be serving as a resource to you, and hopefully you can be serving as a resource and a support to them from back home.
Great, and I think this is our last question, and it is a clarifying question. The advocate says, don't we need to lose 3 Republican votes so it doesn't end in a tie, which Pence can then break?
That's exactly right. In order for the bill to go down, 3 Republican members and all Democratic members of the Senate would need to vote against it. I think when I had said 2, I was saying it from the perspective of the Republican leadership. In order for them to pass their bill, they could only lose 2 votes. If it's a 50-50 tie, just as you point out, Vice President Pence is expected, obviously, to come in and vote on the Republican side. And so if 3 Republican senators, for whatever reason, do not vote for the bill, then it does not have the votes to pass.
All right. Well, with that, the good news, folks, is that we're going to wrap up a little bit early today. If you do have more questions and you were shy about asking, you can always type those in, and we will follow up with you individually coming out of the webinar today. Just a reminder that this is recorded and the slides will be available on hcadvocacy.org. You can look under past events. That's where you'll see them posted as soon as they are available. We'll also put it out in our Washington update, which goes out weekly. Just want to say thank you again to everybody for participating today. As you can imagine, this is a very not turbulent, I'm not going to use that word, but there's a lot going on, and it's changing very quickly, and it's changing almost hourly. And so staying up to speed and informed is one of the best things that you can do as an advocate. And as I mentioned before, we're counting on you guys to deliver the Health Center message effectively and successfully to your members of Congress, but also back home and on the ground. So just encourage you guys to take a look at the tools and resources that are listed under Make the Case on the hcadvocacy.org website. We look forward to supporting you in your advocacy efforts and look for lots more coming from us very soon. So thanks again, everybody, and have a wonderful afternoon. Take care.